Giant coronary aneurysms are seen in A. Cardiac syndrome, B. Ellis-Van Creveld syndrome, C. Kawasaki disease, D. None of the above. Correct answer C. Kawasaki disease. Kawasaki disease is a rare disorder in which coronary aneurysms can occur in young children. Kawasaki disease is also known as mucocutaneous lymph node syndrome. It typically occurs as a febrile illness with involvement of the lips and tongue. There is conjunctival congestion as well as involvement of the lymph nodes, usually in the neck. Redness of palms and feet and peeling of skin may occur as the cutaneous manifestations. Angiotensin II receptor 1 is involved in A. Vasoconstriction, B. Proliferation, C. Aldosterone secretion, D. All of the above. Correct answer D. All of the above. Angiotensin II is one of the most potent vasoconstrictors. It is also involved in the stimulation of aldosterone release from the zona glomerulosa of the adrenal cortex. Angiotensin receptors are G protein coupled receptors. The important angiotensin receptors described are 81, 82, 83 and 84. Fallacies of assessing mitral valve area by planimetry. A. Inability to get a cut at the tip of the funnel. B. Inability to get a cut parallel to the orifice. C. Inability to get a full circle at the right time of the cardiac cycle. D. All of the above. Correct answer D. All of the above. Mitral valve is often measured by planimetry to assess the severity of mitral stenosis. Usual method is to get a good parasternal short axis image of the mitral valve and measure the valve area using the electronic caliper in the echocardiograph. Once you trace the outline of the valve area is automatically calculated and displayed by the computer program in the echocardiograph. Minimum gradient required for diagnosis of tricuspid stenosis. A. 2 mm of mercury, B. 4 mm of mercury, C. 6 mm of mercury, D. 8 mm of mercury. Correct answer A. 2 mm of mercury. The minimum transvalvular gradient required for significant tricuspid stenosis is 2 mm of mercury. Cardiac catheterization derived pullback gradient may not be superior to Doppler echocardiography derived gradient, as cath gradient ideally requires simultaneous right atrial and right ventricular tracings. The right atrial pressures fluctuate widely with respiration. So, in order to measure a small difference between right atrial pressure and right ventricular diastolic pressure, simultaneous tracings would be ideal. Though the measurement of right ventricular pressure requires a catheter across the tricuspid valve, the resultant decrease in tricuspid valve orifice may not be that significant as in the case of aortic valve because of the relatively larger orifice of the tricuspid valve. Tricuspid valve is the largest of the four cardiac valves. The pressure gradient in tricuspid stenosis is not as high as in mitral stenosis because the right-sided pressures are lower than left-sided pressures in the heart. The right atrial pressure tracing in tricuspid stenosis will show a prominent A wave due to the forceful contraction of the right atrium against the narrow tricuspid valve. This prominent A wave is also reflected onto the jugular venous pulse. It can also produce presystolic hepatic pulsations. Platypnea-orthodeoxia has been described in A. Pulmonary arteriovenous malformation, B. Cirrhosis liver, C. Aortic aneurysm, D. All of the above. Correct answer D. All of the above. Platypnea-orthodeoxia is characterized by dyspnea and systemic oxygen desaturation on assuming the sitting or standing position. It was originally described by Burchell et al. In 1949. Wrong statement about defibrillation of heart. A. Person lying in water should be moved out before defibrillation. B. Person lying on ice or snow need not be moved out. C. Chest drenched with perspiration should be wiped before defibrillation patches are applied. D. Anteroposterior shocks are not useful. Correct answer D. Anteroposterior shocks are not useful. Defibrillation electrodes should be placed on the bare chest with the electrode marked as sternum, usually in the right infraclavicular region, and the electrode marked as apex in the infralateral left chest, lateral to the left breast. Alternate positioning on the lateral sides of the chest or biaxillary position can also be used. Another method is to keep the left pad in the standard apical position and the right pad on the right or left upper back. If a pacemaker or other implanted medical device is present, the pad should be kept at a minimum of 2.5 cm from the device. Anteroposterior shocks should be considered to minimize the damage to implanted devices whenever feasible. In case an implanted cardioverter device is delivering a shock, as evidenced by muscle contractions similar to that seen during an external shock, one should wait till the device therapy is completed in order not to interfere with it. Defibrillation patches should not be attached over transdermal medication patches, and these should be removed before attaching the patches. If the person is lying in water, he should be moved out before using a defibrillator. But a person lying on snow or ice can be defibrillated. If the chest is drenched with water or perspiration, it should be wiped out before defibrillation pads are applied. Occasionally, unduly thick hair on the chest may require at least partial removal for successful defibrillation. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.